Starting of Part 2. Welcome back. In the previous video, we discussed the warning signs of hantavirus and why early symptoms can be easy to miss. Today, we're focusing on something just as important: how people get exposed in the first place. Many seniors assume that hantavirus is something that only affects campers, hikers, or people living in remote areas. But the truth is, exposure can happen much closer to home than most people realize. A storage shed that's been closed for months, an old garage, a basement, an attic. Even cleaning up after rodents in or around your home can create a risk if proper precautions aren't taken. The concerning part is that many exposures occur during ordinary activities that seem completely harmless. In this video, we'll break down the biggest risk factors for seniors, the common mistakes that increase exposure, and practical steps you can take to reduce your risk. Let's begin with the number one situation health experts repeatedly warn about: why seniors face higher risk. We have established what hantavirus is, how it spreads, and what it does to the body. Now I want to address directly why this virus represents a particular danger for anyone over the age of 60, and specifically, why the symptoms can be so much more devastating in older bodies. Reason 1. The aging immune system, immunosenescence. The immune system weakens measurably with age, in a process scientists call immunosenescence. The production of new immune cells, particularly T cells, the warriors of the adaptive immune response, declines significantly after the age of 60. The thymus gland, which produces T cells, literally shrinks with age and becomes progressively less functional. What this means in practical terms is that when hantavirus enters an older body, the immune response is slower to mobilize, less robust in intensity, and less precise in targeting. The virus has more time to replicate unchallenged before the immune system mounts a significant counterattack. By the time the immune response does intensify, the infection may already have progressed further than it would have in a younger person. Additionally, the inflammatory response that damages the lung capillaries in hantavirus pulmonary syndrome is actually a product of the immune system itself, a process called immune-mediated pathology. In some cases, an overactive but disorganized immune response in older adults can produce this damage more rapidly and less controllably than in younger patients. Reason 2. Reduced physiologic reserve. Less margin for error. Young, healthy lungs have a significant amount of reserve capacity, the ability to work harder and compensate when illness strikes. After decades of normal aging, chronic inflammation, and potentially smoking or pollution exposure, the lungs of a 65 or 70-year-old person typically have less of this reserve. When hantavirus begins flooding the lungs with fluid, reducing effective air exchange area by 10, 20, 30%, a younger person may be able to compensate and maintain adequate oxygenation for longer. An older person may reach critical hypoxia much faster. The margin between serious illness and respiratory failure is smaller. The same principle applies to the cardiovascular system. The heart of a 70-year-old, even a healthy one, cannot sustain the extreme compensatory effort required to maintain blood pressure against failing lungs for as long as the heart of a 35-year-old. Cardiovascular decompensation happens faster. Organ failure cascades faster. Reason 3. Comorbid conditions. Multiple battlefronts. Most adults over 60 are managing at least one chronic condition. Many are managing 3 or more. High blood pressure, coronary artery disease, type 2 diabetes, COPD, chronic kidney disease, heart failure. Each of these conditions individually compromises the body's ability to fight a serious acute illness. When hantavirus infection arrives on top of an already stressed cardiovascular system, or on top of lungs already compromised by COPD, or on top of kidneys already functioning at reduced capacity, the burden becomes compounded. The virus is fighting a body that is already engaged on multiple fronts. Reason 4. Medication interactions and diagnostic masking. Many medications commonly taken by seniors can alter the presentation of hantavirus illness in ways that delay diagnosis. NSAIDs mask fever and reduce muscle pain perception. Beta blockers can limit the tachycardia that would normally signal cardiovascular stress. Diuretics can temporarily mask early fluid accumulation in the lungs. Corticosteroids suppress immune markers that a doctor might use to identify serious infection. None of this means these medications are harmful in themselves, but it does mean that if you are an older adult on multiple medications, the typical clinical picture of hantavirus may be muted in you specifically, making it even more critical to know the warning signs and to be proactive about reporting any rodent exposure history. Reason 5. Behavioral and living environment risk factors. Many older adults live in exactly the kinds of environments that increase hantavirus exposure risk. Rural properties with outbuildings. Older homes with gaps in the foundation or around pipes. Long-term storage spaces, garages, attics, basements, that have accumulated years of clutter and may have had undisturbed rodent activity for extended periods. Additionally, seniors are more likely to perform solo household maintenance tasks, cleaning a storage room, clearing a basement, working alone in a garage, without a second person present who might notice deteriorating symptoms. And older adults, particularly those living alone, may delay seeking care when symptoms begin because they do not want to be a burden or because they normalize feeling unwell. These behavioral and environmental factors compound the biological ones, creating a genuinely elevated risk profile for seniors that demands specific, targeted protective action. High-risk places, where exposure most commonly happens. Let me walk you through the specific settings where hantavirus exposure most commonly occurs, because several of these will surprise you. Your own home, the most common exposure site. Contrary to what many people assume, the majority of hantavirus exposures in the United States occur not in wilderness settings, but in and immediately around the victim's own home. Specifically, garages, basements, attics, crawl spaces, and sheds. Why? Because these are the spaces that are used infrequently, poorly ventilated, difficult to inspect thoroughly, and most likely to harbor undisturbed rodent populations over months or years. When these spaces are cleaned, particularly after a long period of disuse, dried rodent excreta are disturbed and particles go airborne. Key activities that have been directly linked to hantavirus exposure in the home environment include sweeping or vacuuming areas with rodent droppings without proper protective equipment, removing stored materials from attics or basements, pulling out old insulation, handling firewood stored near or inside the house, and cleaning out rarely opened cabinets or storage areas. Vacation cabins and rural properties. Vacation cabins, hunting camps, and rural properties that sit unoccupied for extended periods are extremely high-risk settings. Rodents freely move in and out during periods of human absence. By the time the property is reopened for a seasonal visit, a spring cleaning trip, the beginning of hunting season, a summer vacation, the interior surfaces may be heavily contaminated with dried rodent excreta. The act of opening windows, sweeping, airing out bedding, or moving furniture in these spaces sends airborne particles into a space that is often poorly ventilated and enclosed. If you own or regularly visit a property that sits unoccupied, please treat every opening of that property as a potentially high-risk event. I will cover exactly what precautions to take in the prevention section shortly. Agricultural settings. Barns, grain storage facilities, chicken coops, feed storage areas, and other agricultural structures are heavily used by rodents for shelter and food. Farm workers, ranchers, and rural property owners who spend significant time in these environments have historically had the highest occupational hantavirus exposure rates. For seniors who maintain a small farm, garden property, or keep backyard chickens, this deserves specific attention. Camping and outdoor recreation areas. Camping, particularly tent camping and cabin camping, in areas known to have deer mouse populations, carries hantavirus exposure risk. Sleeping on the ground, leaving food out overnight, and camping in areas with visible rodent activity are the primary risk factors in outdoor recreation settings. This does not mean you should stop camping or enjoying the outdoors. The absolute risk for any individual camping trip remains low, but specific precautions, which I will detail shortly, can reduce that risk to near zero. The cruise ship context, a new and emerging risk. The 2026 MV Hondius outbreak introduced a genuinely new concern: hantavirus exposure aboard a vessel traveling through areas of South America and remote Atlantic islands where Andes virus is endemic. Wildlife viewing expeditions, shore excursions in rodent endemic areas, and the possibility of rodent boarding the vessel itself are all potential exposure mechanisms under investigation. For seniors who love cruising, particularly expedition cruises to South America, the Antarctic Peninsula, or remote Atlantic destinations, awareness of the Andes virus and its person-to-person transmission capability is genuinely important context for your travel health planning. Diagnosis and treatment. What happens when you go to the hospital? Let me walk you through what to expect if you present to a hospital with suspected hantavirus exposure and symptoms. Understanding this process in advance removes fear and helps you advocate for yourself or a loved one effectively. The diagnostic challenge. Diagnosing hantavirus is not straightforward, and the window of diagnostic opportunity is narrow. Because early symptoms so closely resemble influenza, and because hantavirus is relatively rare, it is not typically the first diagnosis a physician considers when seeing a febrile patient with muscle aches. This is why the exposure history is so irreplaceable. When you walk into an emergency room or urgent care, the first words out of your mouth should be, "I have had potential exposure to rodents in the past 4 to 8 weeks, and I need to be evaluated for hantavirus." This single statement redirects the entire diagnostic workup. It prompts the physician to order the specific tests needed to confirm or exclude hantavirus infection. Diagnosing hantavirus within the first 72 hours of symptom onset is extremely difficult because the viral load may not yet be high enough to detect on standard tests. If initial testing comes back negative, but symptoms are progressing and exposure history is clear, repeat testing 72 hours after symptom onset is standard protocol. Key diagnostic tests. The primary diagnostic tools for hantavirus include serologic antibody testing, which looks for the immune system's antibody response to the virus in the blood; polymerase chain reaction, PCR, testing, which detects hantavirus genetic material directly; complete blood count, which typically shows a characteristic pattern in hantavirus infection: rising white blood cell count, falling platelet count, and the appearance of unusual immune cells called immunoblasts; chest X-ray or CT scan of the lungs, which can show early fluid accumulation before severe respiratory symptoms develop. The combination of these tests, in the context of a clear rodent exposure history and compatible symptoms, allows physicians to make a working diagnosis rapidly enough to initiate appropriate supportive care. Treatment. The honest reality. I want to be completely honest with you about this, because false hope serves no one. There is currently no specific antiviral drug that has been proven effective against hantavirus pulmonary syndrome in clinical trials. There is no targeted treatment that kills the virus or blocks its replication in humans. There is no vaccine. What we have is supportive care, and when provided by an experienced intensive care team with the right technology, supportive care absolutely saves lives. Supportive care for severe hantavirus pulmonary syndrome includes close monitoring of blood oxygen levels and respiratory function, supplemental oxygen delivered by mask or nasal cannula in early stages, mechanical ventilation, a breathing machine, in patients who develop respiratory failure, careful management of fluid balance to avoid worsening lung congestion, management of blood pressure with vasopressor medications, continuous cardiac monitoring and treatment of arrhythmias, and in the most severe cases, extracorporeal membrane oxygenation, ECMO, which is an advanced life support technology that takes over the function of both the lungs and the heart while the body fights the infection. Studies have consistently shown that early hospitalization, before respiratory failure develops, dramatically improves survival outcomes. Patients who reach the ICU before they are in full respiratory collapse have significantly better odds than those who present in crisis. This is why I have emphasized throughout this video. Recognize the signs early, tell your doctor about the exposure, and do not wait to see if you get better on your own once respiratory symptoms appear. Every hour matters. Complete prevention guide for seniors. We have spent a great deal of time understanding the threat. Now let us spend equal time understanding how to eliminate it. Because the good news, and there is genuinely good news, is that hantavirus is almost entirely preventable with specific, practical measures that are within every senior's ability to take. Step 1. Seal. Eliminate rodent entry points. The single most effective long-term prevention strategy is preventing rodents from entering your home and outbuildings in the first place. This requires a careful and methodical inspection of your property. Here is a critical fact from the CDC. A mouse can squeeze through a gap as small as 1/4 inch, roughly the diameter of a pencil. A rat can enter through a hole as small as 1/2 inch. This means that gaps around pipes, cracks in the foundation, spaces around utility lines entering the house, gaps around doors and windows, and openings where the roof meets the walls are all potential entry points. Materials that effectively seal these gaps include steel wool. Rodents cannot chew through it. Hardware cloth with 1/4 inch mesh. Sheet metal flashing. Cement or mortar for larger gaps in concrete or masonry. Caulk and foam sealant for smaller gaps around pipes and utilities. Do not use wood, plastic sheeting, or rubber alone to seal entry points. Rodents can and will chew through these materials. Walk the full perimeter of your home, garage, and any outbuildings. Get on your hands and knees if you need to, or ask a family member or professional to do this inspection for you. Every gap you seal is a rodent that never enters your home. Step 2. Eliminate. Remove food and nesting opportunities. Of these three, and the appeal of your property drops dramatically. Remove all three, and you have made your property genuinely inhospitable to rodent habitation. For food, store all human food in hard-sided sealed containers, not cardboard boxes, not paper bags. This includes dry goods like rice, grains, cereals, and nuts. Store pet food in sealed metal or hard plastic containers, and do not leave pet food out overnight. Keep garbage in sealed bins with tight-fitting lids. Clean up fallen fruit in gardens and outdoor areas promptly. For water, fix any dripping pipes or faucets. Eliminate standing water sources in the yard. Ensure gutters drain properly away from the foundation. For nesting, reduce clutter in garages, attics, basements, and sheds. Rodents nest in cardboard boxes, old clothing, newspapers, and stacked firewood. Store items in hard plastic bins with lids, rather than open cardboard boxes. Keep firewood stacked away from the home's exterior, at least 20 feet if possible, and elevated off the ground. Step 3. Trap. Active rodent population control. Even with the best sealing and food storage practices, rodents can still enter homes, particularly in autumn and winter when outdoor temperatures drop. Maintaining a set of snap traps inside the home, in garages, and around the perimeter provides early detection and active population control. Snap traps are more effective and more humane than glue traps and are safer to use than rodenticide poisons, which can cause secondary poisoning of pets and predatory wildlife, and which leave dead rodents in inaccessible places where their decomposition creates additional risks. Place traps along walls. Rodents travel along edges rather than open floor space. Check traps regularly. And critically, when disposing of a trapped rodent, wear rubber or latex gloves, use a double plastic bag, and do not handle the carcass with bare hands. Step 4. Clean safely. The most overlooked protection. Cleaning an area with evidence of rodent activity is the highest risk activity for hantavirus exposure. The instinct is to sweep or vacuum, and that instinct, if acted upon without precautions, is exactly how exposure happens. Sweeping and vacuuming send dried rodent excreta particles airborne, directly into your breathing zone. The correct protocol, as established by the CDC, is as follows. Never sweep or vacuum rodent droppings, nesting material, or dead rodents dry. Ventilate the area first by opening windows and allowing fresh air to circulate for at least 30 minutes before entering. Wear rubber, latex, or vinyl gloves throughout the entire cleaning process. Spray all droppings, nesting material, and contaminated surfaces thoroughly with a disinfectant solution. A mixture of 1.5 cups of household bleach per gallon of water is effective and inexpensive. Allow the disinfectant to soak for at least 5 minutes before cleaning up. Use damp paper towels or a damp mop to collect the material. Never dry. Place all collected material in a double plastic bag, seal it tightly, and dispose of it in a covered outdoor trash bin. After removing gloves, wash your hands thoroughly with soap and water for at least 20 seconds. For areas with heavy infestations, evidence of a large rodent population, extensive droppings throughout a space, consider contacting a professional pest control service and specifically mentioning hantavirus concerns. Professionals have access to appropriate personal protective equipment, including N95 respirators or higher, and have training in safe remediation protocols. For seniors, I want to emphasize this particularly strongly. Do not clean heavily infested spaces alone. Have a family member present or hire a professional. The physical exertion combined with potential high concentration exposure in an enclosed space represents a significant risk for older adults. Step 5. Protection when outdoors. For camping and outdoor activities in known hantavirus endemic areas, specific precautions significantly reduce exposure risk. Camp on elevated ground away from dense brush and tall grass where rodents nest. Use a tent with a floor. Do not sleep directly on the ground. Keep food in sealed containers and never inside your tent. Avoid areas with visible signs of rodent activity, burrows, droppings, gnaw marks. Do not disturb rodent burrows or nesting areas. If you are at a camp with a cabin, air it out thoroughly before spending extended time inside. If you notice signs of rodent activity in a cabin, droppings, chewed materials, clean according to the protocol above before making the space your living area. Step 6. Recognize your personal risk level. Finally, spend 2 minutes thinking honestly about your personal hantavirus risk level. Do you live in a rural or semi-rural area in a western or southwestern state? Do you have a garage, basement, attic, or shed that has had limited use recently? Have you seen any signs of rodents, droppings, gnaw marks, nesting material, or the rodents themselves, in or around your home in the past several months? Do you visit a vacation property seasonally? Do you do gardening, farming, or any outdoor maintenance work? If you answered yes to any of these questions, your personal risk level is above baseline, and the preventive steps I just outlined are not optional considerations. They are specific actions that could prevent a life-threatening illness. Let me bring everything together with a complete, clear recap. What is hantavirus? A family of rodent-borne viruses. In the United States, the primary threat is hantavirus pulmonary syndrome, a lung-destroying illness with a 30 to 50% fatality rate in severe cases. The 2025 death of Betsy Arakawa and the 2026 cruise ship outbreak are both stark recent reminders that this threat is real and active. How does it spread? Primarily by inhaling dried aerosolized particles of infected rodent urine, feces, or nesting material, also by direct contact with contaminated material. The Andes virus, currently causing the 2026 outbreak, is the only strain that can also spread person to person. The 11 warning signs, in order of appearance: fever, deep muscle aches in the thighs, hips, and back, profound fatigue and weakness, severe headache, nausea, vomiting, and abdominal symptoms, dizziness and lightheadedness, chills and night sweats, shortness of breath, emergency. Dry, persistent cough, emergency. Chest tightness and pressure, emergency. Dropping blood pressure, critical emergency. Why seniors face higher risk? Weakened immune response, reduced lung and heart reserve, multiple comorbid conditions, medication-related masking of symptoms, and behavioral and environmental exposure factors. If you suspect exposure, tell your doctor immediately. Say, "I have had rodent exposure in the past 4 to 8 weeks." Request a complete blood count, metabolic panel, chest imaging, and hantavirus-specific testing. Prevention in 6 steps. Seal entry points. Eliminate food and shelter. Trap actively. Clean safely with disinfectant. Never dry sweep. Use protective equipment outdoors. Know your personal risk level and act accordingly. An hour ago, you may not have known what hantavirus was. Now you know its history. You know where it lives and how it travels. You know the 11 warning signs and the exact timeline of how this illness progresses. You know the specific reasons why the body over 60 is more vulnerable. You know where exposure is most likely to happen, including in your own garage. And you have a complete, step-by-step prevention protocol that you can begin implementing today. That is not a small thing. That is the kind of knowledge that saves lives. Betsy Arakawa was 65 years old. She was healthy. She was active. If she had known these signs, if she had recognized those early flu-like symptoms in the context of the rodent activity near her home and sought emergency care immediately, the outcome might have been different. We cannot know for certain, but knowledge changes the odds. It changes them significantly. I am asking you to do 3 things right now, before this video ends. 1. Share this video. Not just to one person. Share it widely. Put it in your family group chat. Text it to your parents, your siblings, your adult children. Post it to your community Facebook group or neighborhood app. If even one person watches this video and recognizes hantavirus symptoms in time to get to a hospital before their lungs fail, that is a life saved. That matters more than any view count. 2. Go to your garage, your basement, your attic, or your shed this week. Look for signs of rodent activity. Droppings, gnaw marks, nesting material. If you find any, do not clean it up dry. Follow the protocol I gave you, or call a professional. But look, because you cannot address a threat you have not identified. 3. Leave a comment below. Tell me your biggest takeaway from this video. Tell me if you have had any rodent issues in your home. Tell me what topics you want me to cover next. Your comments shape this channel, and I read every single one personally. And if you are not yet subscribed, what are you waiting for? Subscribe right now. Hit the bell. Every week I publish content specifically designed to help you protect your health, understand your body, and navigate the medical landscape with confidence after the age of 60. I am Dr. Morgan Andewala. Take this seriously, take action, and I will see you in the next video.